Dear listeners, in my interview with Dr. Chang, she speaks about her role as an end-of-life doula and the importance of aging, illnesses, and dying, and what that means in the last chapter of an elder's life. She offers unique perspectives as well as issues that we may not always think about or know during this process. Stay tuned. Welcome, Virginia. It's such a pleasure to see you again.
Thank you so much, Harlem, for inviting me to come and speak with you and to share with your audience.
Yes, this is a long awaited interview, and I am excited to hear about what I would consider an unprecedented space in elder care. So please share with us a bit of your background and what you do in the elder care space.
Okay, so first, my name is Virginia Chang, and I am a certified end-of-life doula. And why Harlem says that this is sort of unprecedented is because end-of-life doulas are an emerging new professional in the healthcare end-of-life space. The concept of an end-of-life doula is less than 20 years old.
Wow.
Yes. A handful of healthcare professionals in different parts of the country kind of said, oh, we could be doing end of life better. And they kind of came up with their own concepts about how to approach death differently. The first end of life doula training program was only established in 2015. So that was only 10 years ago, less than 10 years ago.
Okay.
I did most of my work and training in 2017, 2018. So it was very much in the early times of end-of-life doulas in the field. And then when COVID happened, the field has just exploded. And there are tens and tens of training programs. There are thousands of end-of-life doulas now out there. And I would really say that we are part of a movement to transform the way we think about aging, illness, and dying in current society in America.
Wow. Before I ask you about different types of services you provide, can you share with us a little bit about your sort of educational background? Because I was actually fascinated about your background and also share what led you to the interest in the end-of-life doula.
Thank you, Harlem, for asking me that. So I'm probably unlike many other people who are doing the work now, which is I don't come from a healthcare field. So I am a research scientist. I'm originally an organic chemist, and I had two careers as a scientist. My first was as a research scientist doing research for new drug designs. So how did I come to do end-of-life doula work, right?
Yes.
So I, like most people, approached middle-aged with having a family and then having my elders. So I'm part of what's called the sandwich generation, which is I'm taking care of children and I'm taking care of elders. And I realized that a lot of the burden of caring for my parents were going to fall to me. I lived the closest to my parents, and I knew that I was going to be the child to carry them through to the end. So in late 2016, my father ended up dying of a massive heart attack. Then my mother-in-law died in January of 2017. And then my own mother died in April of 2017. So I had 3 deaths of parents in 7 months. And I have to tell you, Harlem, it was my first real exposure to death in the first 54 years of my life. I had really been very sheltered, ignorant. I didn't have any deaths, close deaths of peers or loved ones, or even pets as a child, as a young adult. And so I never thought about death. I never really experienced the emotions. I didn't understand what loss meant. I didn't know what grief was, really. Or at least, let's say, grief related to death, right? So then all of a sudden, I had 3 deaths in 7 months, and it was just like a tsunami of emotions and intense, overwhelming. And I will tell you that some of the deaths did not go well. And that was a major reason why I'm doing the work today, is because some of the deaths did not go well in terms of the medical establishment not honoring the wishes of the family with regards to medical treatment. And they did things against families' wishes and horrific things to the bodies of the people that you love.
Sorry to hear that.
And so you're kind of left with these memories, right? Like, this is the way you're supposed to remember your loved one's last days, hours on earth,
Yes.
right? And first of all, it's like, is that what they even wanted?
Hmm.
Why were not the family's wishes respected? And then how are you, as a surviving family member, supposed to live with these memories moving forward? It's a really hard thing. And I'm sure that my experience is not uncommon. I think this
Yeah.
is a very common experience for many people. Like, how are you supposed to live with some of the memories of how your loved ones die when we are living in a society that doesn't revere death, that doesn't uphold it as a sacred, honoring, beautiful time that and now you're stuck with these memories, and this is like how you're supposed to remember them as their last moments on earth.
Yeah. Thank you so much for sharing that, Virginia. A lot of what you shared resonated in so many ways because my entire career, unfortunately, has been around death and dying and sickness and ill health. So it was very fresh to me. And similar to you, it was because of experiencing these grave or witnessing the grave experiences with access to healthcare, utilization of healthcare, poor quality care that led me to what I'm doing now in with the podcast and eventually a documentary. Again, thank you so much for sharing. That really means a lot to me, and I'm certain for those who are listening as well.
Harlem, I
Huh?
will just add, let me just add though, that my big takeaway from my whole personal experience is that we could all be aging and dying better, right? That it doesn't have to be this way, that it shouldn't be this way. And so, in my pursuit to try to find healing for myself, I then began to realize that this wasn't something that anybody should have to go through death with their loved ones like this. And so so then I decided, like, I actually changed my whole life to begin to do work in this field and to try to make a difference, because I realized that I could not change what had happened to my loved ones. But if I could help someone else on their path to do it differently, then it would just be a way that I could honor what had happened to my parents, learn from it, and then give back to society.
Yeah. So, if you don't mind, so tell us. So, you had this groundbreaking experience or epiphany after these challenges with your loved ones, and how do you then? What type of services do you provide, and how do you then work now to avoid or prevent that from others having that experience?
Right. So I'll just say that I never thought I was going to be an end of life doula, right? I started to learn about death and dying and end of life doulas because that's where the knowledge is about death,
Okay.
right? And that's the place where, do you know, I give a talk in a medical school about end of life doulas, and we're training medical students to be doctors that will go out into the field and have this profession for the rest of their lives. They're going to medical school for 4 years of their life, 52 weeks in a year. 1 week out of 208 weeks is dedicated to aging and death.
Wow, really?
Yes, I speak to that medical school class in that 1 week.
Wow.
Okay, so you can see how even in some healthcare professions, we're not talking about it,
Right.
right? And so I found that the end-of-life doula field, this burgeoning field that was being created, these training schools that were out there, that's where the knowledge about death and dying was being discussed, talked about in a very open way. And so I went there because that's where the knowledge was, not because I actually had any intention of being an end-of-life doula. And that's where I kind of really learned about what's going on now in society, what we can do differently. And what I took away from my trainings, my learnings, my approach to the work is empowering other families to understand what's happening to them, retaining their autonomy and control in the process, and to never lose their identity of who they are, even when they are ill or aging. Too often, we see people that become identified by their illness rather than retaining that I am Virginia and I'm sick. And so my whole approach to illness and dying is that it should be positive, it should be meaningful, and it should be affirming of who you are as an individual. And that gets us out of the assembly line, conveyor belt process of the medical establishment and the bureaucracy that we see in so many systems that are driving care in America.
Yes. So help me stay with that, not losing oneself during this process and staying in line with who you are. So help us to sort of understand what is that like as a doula and in terms of the services you provide or the resources that you have. Help me to frame that or put it into perspective for our listeners.
A lot of that has to do with remembering who you are and who is important to you and what is important to you, and using those factors in your decision making about your health. That all the decision making about your health shouldn't just be driven by medical facts, medical precedents, or even what your doctor says. Their recommendations come from a medical perspective, but it may not necessarily be what's best for you and your family and what you feel most comfortable with. So, as an end-of-life doula, we are non-medical professionals, and our role is really to guide, support, educate, and companion dying people and their families and loved ones in the transition to this reality, to whatever is next. Okay. So I would say that, in particular, given my background, coming from a strong education PhD background, I really take the part about education really seriously. And so this really means educating my clients, the elderly, about options, choices. I would say that many people that you'll encounter, even the doctor, the nurse, the social worker, they will give you their recommendation on what they think is the best course of action based upon, and that their recommendation may not be the best thing for you personally. It may be driven by beds available. It might be driven by finances, right? There could be many other factors which are really not important to you that might be driving that recommendation. So what's important to remember is that there actually could be many other options and choices available out there. And it's really knowing what all your choices are and then making the one that's best fit for you. as opposed to the one that may be the recommended one. Maybe the recommended one is the best fit for you, but it's really different when you're making that choice based on your values and your beliefs and your religion, your faith, your culture, your traditions. Then it feels like this is right for me. I can do this, right? You're coming from a whole different place and a whole different level of mental peace, security, mindset about approaching what's happening to you down the pipeline if you're making a decision based on those kinds of values than just medical alone. So as an end-of-life doula, I really seek to inform my patients, not only with information, but also some of it is like knowing a lot of just like information and facts and options and choices, but a lot of it is reminding people who they are. So this is going back to that identity question of you that you had asked me earlier. And so it really is almost like turning on that switch in somebody's mind about like, tell me about yourself. What's important to you? Like, what do you love to do? What are your favorite things? Or there was a woman who I just met recently and she loves classical music. She used to go to Lincoln Center all the time. And so here she is dying in hospice. And I'm like, let's listen to music together. And she said, no. And I said, why not? Right. And she said, no, I don't want to listen to music because that was my other life.
Mm.
Right. So now she's identified herself as this sick person who doesn't deserve to have any joy and listen to beautiful music that she loves. Like, right? Why do we need to suffer, right? Why do we give up what we love and lose ourselves and just become this thing that's like gritting our teeth to get through to the end,
Mm.
right?
Mm-hmm.
And so it's really getting to know each person on an individual basis and helping them to rediscover who they are and bringing that back into the process so that they feel they had a place on this earth, that they're remembered.
Mm-hmm.
And when you feel like you're leaving this world and you won't be forgotten and you realize that your life had meaning and you've impacted others, there is just a whole different sense of peace and security
Mm.
that goes with you when you're lying on your deathbed.
Mm. I think you said it brilliantly that we should not be defined by necessarily by the medical recommendations, as well as there may be several or so many different factors that influence medical decisions that has really, to this degree, or in some reference, haven't really been spoken before in my interview. So I thank you for bringing this up. Now, as I'm listening to you, his end of life can take so many different forms and variations, so many different cultures, so many health conditions that can bring us to that point or time in our lives. And as I'm listening to you, I'm thinking of someone that's coherent, someone that has the ability to communicate. How does that work with someone who may not be coherent, who cannot communicate, who have suffered a stroke or,
Yes.
yeah. So please share with us.
I will tell you about a client that I worked with. He was only 52 and he had ALS.
Wow.
And by the time he contacted me, he could no longer speak.
Okay.
He was full-time in a wheelchair. He had already lost his ability to speak. So he contacted me by email and we had to go back and forth a lot by email to figure out, like, if I were to work with him, how would we communicate, right?
Okay.
And I really had to be flexible and really kind of brainstorm a way that let him know that I valued him, that I still saw him, and that I was willing to move at his pace and acknowledge that whatever he could contribute was worth hearing.
Yes.
So I ended up going with my laptop to meet him in person. He actually initially suggested that we do it just by Zoom,
Okay.
and that he would use a voice synthesizer to translate his typed words into speech.
Okay.
But I said, I would really like to meet you, and this is intimate work. I wanted to meet him, to see him in person. Body language tells so much.
Yes.
So I went with my laptop, and he lived in a studio apartment with his mom, who was caring for him as full time, and a daytime aide that came.
Wow.
So there were 3 people in the daytime in this studio apartment caring for him full time. And he had this slightly partitioned area that was his area. I came with my laptop, and what we did was I worked with him for an hour, and we never said a word to each other. The only sound you heard was maybe him gurgling and me laughing. But I had pre-prepared a bunch of topics or statements or general thoughts or concepts, and I typed on my laptop. He would read from my laptop, and his hands were already so deformed and frozen that he needed to hold one hand, and he could only type by using a knuckle on his phone.
Wow. That's amazing.
And it was challenging, right? So the pace is much slower. But what happens is, because the pace is much slower and you want to make the most of your time, you get to the heart of the matter very quickly, right? There's no wasting time of trivialities, right? And we developed this system where he would prep me ahead of times about the topics that he would want to discuss. One day, I woke up and he sent me a 4-page, single-spaced missive
Wow.
of his thoughts that, my God, this is a man who's typing with one knuckle. And I mean, he was typing for hours to write this missive to send to me. That's part of what I, as an end-of-life doula, can give to him, is to let him know that I see him, I hear him, I will remember him. And that and this is what I tell him, I don't know the old person. I don't know the person that existed before you had ALS. I only see you now. And to me, you have still value as that person. And that's what I kept telling him. I see value in you as you are. And I know you don't see much value in yourself because you only remember the past person you were. I said, but you have to start looking at yourself like I see you.
Wow.
So I will say, Harlem, that the way I think about it, I, as an end-of-life doula, am here to meet you wherever you are in your life's journey, with ever challenges, difficulties, fears, joys in your life, and take you as far as you want or stay where you are, but to let you know that I'm with you.
In the space of healthcare, what has been your experience working with clients or patients regarding healthcare? If you can share with us maybe challenging or outstanding issue and how you have worked to sort of overcome that.
Well, I will say in general, for all 3 of the topics, which you said, medical, financial, and legal, my role as the end-of-life doula is to be your sounding board.
Oh.
And yes, I have no specialty, or obviously I don't have the type of knowledge, in-depth knowledge, as an estate planning attorney might have. But my role is to talk you through what you're thinking, and always to remind you, how does this apply to you? Does this feel good to you? Like, is this something that you don't feel comfortable with? Why? What is it rubbing against? And really help you to explore the information, the recommendations, the suggestions that a doctor, an attorney, or financial advisor might present to you and say, how does this feel with you and your family and your situation? And I guess I didn't really emphasize this earlier. As an end of life doula, we will have talked about your vision for what you want at the end, right? The end of your life, planning, like where do you see yourself going? How do you see this playing out? We will have talked about this. And then, as a sounding board, work with this. Any decision that you have to make in the medical, financial, legal area, are these decisions moving you towards the end that you have identified as this is what you would most ideally like, right? Everything
Mhm.
you want to be doing is moving you towards that end, right?
Mhm. I guess my question is just from your experience and as being the sounding board, what are some sensitive issues or health around healthcare that
Mm.
your patients, your clients had to contend with?
Okay, so let's probably a common one is taking the medical establishment and the doctor as too much of the authority. But I know you're a doctor too, so I'm sure you relate to that, right? Sometimes you feel that you're the authority on this thing, but keeping in mind, yes, this might be as the doctor or or the hospital making this recommendation. Is this what you want as an individual, right? Are you really being heard with your goals of care, with your life? Is this really resonates with you, right? I would say that is one of the biggest challenges where a patient might really feel like not in sync with what might be the hospital or doctor's recommendations, like, oh, you should do this, right?
Mhm.
Or let's say like the patient wants to like stop treatment, but the doctor feels like you still have a good chance if you tried this one more thing,
Right.
right? Or it could even be the reverse, where the doctor likes is saying, there's no more treatments for you, and maybe you want to keep going.
Mhm.
And you don't understand why he's not like telling you about more things that you could be done, right? Why is that disconnect occurring, right? So I would say that's one of the biggest problems. But I would just say like it's not because anyone's trying to, it's just that, hospitals, doctors, nurses, limited time, limited bandwidth, overworked, a lot of patients, a lot of care. And maybe you don't have the kind of time to really dedicate to each patient and make them seen as heard as they'd like. So that's kind of like what end of life doulas do. But the question is challenging to do that for every single person on this earth that deserves to be seen and heard and remembered, right?
Right. And what sort of legal issues have you encountered?
Ah, legal. I would say the number one legal issue that I encounter is people think because they already have a will, they are ready for dies. That they're ready for death, right? Like, oh, I have my will, so now I'm all set for like,
The next chapter.
yes, the next step, right? Like I'm prepared. The will is just like one small, really minor part of
Really?
yes,
Yes.
yes. Because really, if you keep in mind like wills, trust, estate planning, that's really all about your money and your property,
Right.
right? There is so much to you as a person
Mm-hmm.
that's
Mm-hmm.
not really to do with money and property. But we have such an emphasis on materialism, our consumerisms.
So you were saying there's so much more than property, estate, the money in the bank, finance.
Yes,
Yes.
yes. And so I wouldn't say necessarily that that's a legal issue, but it's more that people feel that if they've done their will, then they're ready, they're prepared. But being prepared for serious illness, being prepared for end of life is so much more than just legal.
Yes.
Of
And
course, it is important. It is important to get the legal aspects taken care of so that you're minimizing conflict between family members.
as you were saying, there's a lot more to unpack than just the legal and financial issues.
Of course, it's important to get the legal and financial issues taken care of
Mhm.
because, as I said, it will minimize the amount of conflict between family members and it'll be clear what your wishes are for your finances and your property. But in terms of preparing for end of life, there's so much more than just your money and your property.
Your estate, yes, yes,
Yes,
I agree.
so
Uh,
much more.
what are, and I'm sure you probably have dealt with this more than anyone else, what about issues of euthanasia and options around that? And what have been your experience or have you encountered that?
Is what we have in America is what's called medical aid in dying.
Okay, so it's not euthanasia. So
So medical aid in dying and euthanasia have the same intention, which
okay,
is to alleviate suffering for terminally ill patients. The
okay,
difference is that euthanasia is when someone else, like a medical professional, or when someone else intentionally ends your life.
okay,
Medical aid in dying is when you administer the medication yourself. So you are making a self conscious choice to hasten your own death.
okay,
So it must be very clear if someone else ends your life, that's illegal. You take your own life through medical aid in dying, that's legal in 10 states and the District of Columbia.
Thank you for distinguishing the difference between medical aid, end of life, and euthanasia. And what has been your experience?
Oh, it's a big movement right now. And the reason why there's a lot of public awareness right now about what are the options available at end of life for two things. One, we've been on a path for decades, pretty much since like the mid 1950s, where, as I said, people are dying in a very assembly line kind of manner, right? Very non-personal, very all costs to save lives, can be very aggressive, not a lot of respect for the human. And I think this just really, it had been growing, but like really sort of like under the rug. And then COVID really changed everything. And I think this is like the silver lining to COVID. I mean, it was an enormous global tragedy. What it did was it woke people up to the fact that we are not dying well. And it wasn't just that COVID forced us into conditions that weren't dying well. It just lifted the rug and made it clear that people were dying isolated, without adequate support, the disparities in care between classes, socioeconomic status, the depersonalization of death. I mean, it just really made it so obvious that worldwide we are not handling death well. And so, because of that, we're now in a real point in history where we can take a look and say, okay, how can we do this better? And what can we do to make this better? And so, I'm sorry, what was your original question?
Yeah, that's a good question. What was my original question? I think we were talking about euthanasia, medical assisted. Yeah,
Right. So, because of COVID, now people are like, I don't want to be dying like that. I don't want to be dying like the way people died during COVID. And so now people want to know what are their options? What are their choices? And they don't want to like extend their life and suffer. They don't want to be hooked up to machines for the rest of their lives. They want to be surrounded by love and family, right? They don't want to just be put off into a nursing home forever,
yeah.
right? And
Hmm.
people only coming to visit them once a month, right? I mean, this whole concept during COVID where like family could only see their loved one through the window, right? I mean, I think you know, Harlem, that loneliness is an epidemic,
Yes. Oh,
right?
it is
And
horrible. It really is. Yes.
yes, and loneliness, we're saying, oh, well, loneliness for marginalized people or poor people or people in poverty, we don't really talk about it and ignore it. And we're like so hush about it. But now, because of COVID and well to do people were dying alone, that's not the same as loneliness, but it woke people up to the fact that being alone, whether it be under forced circumstances or socioeconomic or societal circumstances, is a problem.
Right. I'm happy you touch on that because,
See, there's so many things we can talk about, Harlem.
yeah, yeah, no, that's why I was so excited to have this interview with you. So, as you talk about the socioeconomic status, what has been your experience sort of looking at or dealing with low income, middle income, or high income as an end of life doula? What is that like?
So, interestingly enough, what you do find in a lot of lower income, especially immigrant communities and populations, is that actually, because of probably finances, families show up for each other a lot more,
Yeah,
right?
yes.
They're much more like, they're used to the concept of the system not working for them.
That's such a great point. One would think that it would be the other way around. Yeah,
So they have come to learn to rely upon their community a lot more. I mean, I'm not saying that this is for everyone, right?
correct.
There are definitely
Yes,
marginalized people who have no one,
right.
right? There are a lot of people who are dying alone and never discovered, a lot of unhoused people dying on the streets,
Mhm.
really tragic conditions. But I would say I see a lot of lower income, a lot of immigrant families who, especially maybe where English is not their first language. And I would say, as an end of life doula, my role in that case is a lot about they're already showing up for each other. That's really the key. They're already showing up for each other. Now it's more about like maybe helping them to advocate better, right?
Mhm.
Helping them to understand the system better, right? Helping them to maneuver with the system better. Maybe educating them a lot about what the choices and options are and to realize that they are just as deserving as every other person.
Wow.
So I work with like, I really believe that every single person who wants support deserves to have support regardless. So I've worked with a lot of lower income families, a lot of immigrant families, and the challenges are different, right? The challenges are different than you're working with like a very well to do white family from a high socioeconomic class.
Yeah. How is that different? Share with us because one of the reasons that led me to start the Elder Care Project is because of my exposure with a a low income parent, medium income parent, and a high income parent. And knowing and realizing the difference between the way care is managed, either through medical, legal, finance, and these different socioeconomic the gradient or spectrum. So, what is that like for a sort of affluent family? What is that? I would imagine it's sort of flipped differently, or upside it down, uh, compared to, as you say, an immigrant community or low income community where there's a stronger sense of community and support, and it's the table has sort of turned for the more affluent family, they're more removed. Please share with us.
Yeah, I mean, obviously, wealthy, well to do families have more access. Really, access is probably the biggest thing, right? Access
Mhm.
to better care, better palliative care, hospice services, private care, private nursing, private home health aides, round the clock care, right?
Yes, yeah.
Right? Maybe even staying at home is an easier option because they can bring in care, although sometimes I've heard some well-to-do families, they don't want to die at home, and so they get they get a beautiful suite at Weill Cornell on the top floor with this amazing view of New York City, right? No, but I mean, obviously, access to care can really make a difference. Let me just back up and say that it is true that while socioeconomic factors definitely affect aging, care, medical care, services, dying, and end of life, I think one of the more universal things that cut across all of that is just like the emotions people have when they're sick, when they're dying, and things that they have like fear, anxiety, uncertainty, doubts, regrets, shame, all those sorts of things are universal feelings that a lot of people commonly have at end of life that cut across all socioeconomic classes. So,
And I think that is the most powerful thing to witness, triage, if you will, or be a sounding board for someone at the end of life.
so that's what I wanted to say when earlier when we were talking about sort of like that legal and finance thing. It's you might think you have all your ducks in the row in terms of legal and finance. You might have the best care in terms of, well, if you're well to do, you've got round the clock private nursing. And if you're a lower income, you've got your extended family doing shifts coming in and caring for you. But if you're afraid, none of that is gonna, none of that will make the end any easier.
Wow. Thank you for sharing. So, my last question, Virginia,
Okay,
if
I'm
you,
sorry.
we can go on and on and on, but one thing I'm curious about, how do people get in contact with you? What is the sort of the process for for them to sort of hire you, if you will, or select you? Does insurance cover for it? Like, how does this all play out?
So nowadays, there are quite a lot of doulas, end of life doulas, although I think many people have still not heard of end of life doulas. If you were told about it and you sort of Googled in your community, you could probably find someone in your, maybe not in your tight local area, but in your general regional area, you'd probably be able to find end of life doulas. There are now training organizations and associations all across the country. There are directories of end of life doulas that exist. So you could always Google to find an end of life doula in your community. A lot now, even some hospitals and hospices have end of life doulas that are either on staff or they're part of the volunteer crews that come and serve and see patients. So most of the times it's most effective to have an end of life doula in your local area, right? They know what your community is like, they know your people, they know what the constraints are, they should know what the resources are. So it's usually best to try to find an end of life doula in your local community. That would be the most effective. I would say so. Before COVID, I always saw people in person in my area, which is New York City. But since COVID, I have developed a remote practice as well. So now half my patients are remote and half my patients are in person. When it's remote work, sometimes it's directly with the person who's older, aging, or dying. And as they continue to deteriorate, then my support might shift to working with the caregivers or the families. So I specialize in emotional support in aging and end of life. And sometimes, I mean, I actually do a lot of work with people who are not even sick, but they want to be prepared for entering their later years, or they want to be prepared for end of life, which really theoretically can happen at any time, right? It doesn't have to be only when you're old. It doesn't have to be only when you're sick. It can really happen anytime. It's really more about your worldview of understanding that we're all living and dying. Death can happen at any time. And how are you living your life now? And are you really living it to the fullest? And are you good about where you are now? And are you prepared for facing end of life whenever that could be? So find an end of life doula in your local community. People can find me. I have a website, which is called Till, Till, the last, Till the last. And they can reach me through my website. They can email me at Virginia at tillthelastdoula.com. I'm not on social media, so you'll have to just go to my website. I do a lot of talking. I give a lot of public talks. I'm really into public awareness, libraries, community groups. I'm going to give a talk at a senior center in Brooklyn probably in the next month. I actually have a Zoom call to arrange the date on that. I give talks at hospitals, nursing groups, social work schools. I'm really trying to just help to increase the conversation about public awareness and realize that you have choices out there. You can make a difference for yourself, and that there are people out there also who are willing to travel that journey with you. You don't have to do it alone.
I would say for a lot of us, it may be something that came across our minds or that we think about, but really haven't really dived into, and what it's like to experience the end of life. So thank you very much